And with measles making its way into the state, reporter Bella Demosthenes sat down with a healthcare professional to discuss some common misconceptions about the highly contagious disease. Bella joins us now in the studio. Now, we've heard all week about how contagious the disease is. Did you get some insight on exactly how contagious it is?
Yes, Yvonne. Dr. Megan Senior of Western Colorado Pediatrics tells me for every one person who contracts the measles, they are expected to infect 14 to 18 people before the end of their illness. Let's take a look.
In comparison, both COVID and flu, we would expect 1 to 2 people get infected for each one person.
Dr. Stinner tells me the most effective way to prevent measles is the MMR vaccine. Typically, babies would get their first dose of the vaccine at 12 months old, but under certain circumstances, that could change.
If Colorado were to become an area of an outbreak, which we are not yet, or you're planning to travel internationally or planning to travel to any areas of the country that do have a measles outbreak, we do recommend moving that measles vaccine up to 6 months of age.
That first MMR vaccine is 93% effective in preventing a measles infection.
After your second measles booster, which needs to be at least 28 days after the first, improves that to 97%.
For a community to be considered protected from an infectious disease, 95% of the population must be vaccinated, which is not the case for the Western Slope.
For Mesa County and District 51, we're right around 93%. Delta County School District is as low as 85%.
Some parents may choose not to vaccinate their children due to health reasons or personal beliefs, which is legal, but the child's school must be notified.
If we do have measles in Mesa County, the school district is going to reach out to those families whose kids do not have a measles vaccine, and they're going to say, it may not be safe for your kid to come to school. It is not meant to punish them, but to keep them protected.
Dr. Stinner tells me in the early days of infections, symptoms may present as fever, cough, or pink eye-like symptoms. And that classic measles rash typically doesn't start until 4 to 7 days after infection. Back to you, Yvonne.
All right, thank you, Bella. And if financial hardships are stopping you from getting your child vaccinated, the Vaccines for Children Fund provides vaccines for low or no cost to families who are uninsured or underinsured.